Yesterday, the federal government announced $1.2 million in funding aimed at bolstering mental health support in Saskatchewan's north. The money comes months after northern Saskatchewan communities were rocked by a series of teen suicides. It's for developing new mental wellness teams who will work on the Peter Ballantyne Cree Nation and Lac La Ronge Indian Band. Dr. Sarah Dungable is a Saskatoon-based psychiatrist who flies into La Ronge monthly, working with people who need help. She joins me now in Saskatoon. Sarah, what do you make of the government's announcement?
Well, I'm really happy that they're actually giving the money to the communities so that they can create some community-specific mental health programs that will try and meet the needs that they've identified in the community. There's something wonderful just to be said for a community having a conversation about their mental health and what they would like to see happen. I'm concerned that this may be the Band-Aid that the government puts on a problem that's quite a bit bigger, and after 2 years there'll be no ongoing funding to continue to support these programs, or there won't be ongoing development of the north to help actually treat the underlying upstream mental health issues that are going on.
What are some of the most serious health conditions and health issues that you think need to be addressed with this money?
In terms of what needs to be addressed with this money, I think that's got to be the community deciding it. They know how best to spend what's going to boil down to $300,000 for the first year, $300,000 for the second year for each community. That's not actually very much money to make big changes with. And I think they're probably going to have the most creative and realistic ideas about what they can accomplish with that money.
How much can a community realistically do with that amount of money, do you think?
Well, if we think about paying the salaries of another few social workers or psychologists, that money's not going to go very far. People with good training who will need clinical support to go do the work, who need housing, who need transport to get there. It costs a fair bit of money to actually get your specialists up to the north. If they're putting the money towards some community programs, maybe they're going to be able to stretch it further. Maybe they're going to be able to get a bigger impact out of it. But the communities themselves know what they need.
And we know La Ronge would really like to have a wellness center right in their community. The health minister said that's not entirely off the table, but it's just not in the works right now. What kind of a difference do you think something like that would make?
Well, I think a health center would be great for all of the professionals who are coming in to help, who can't be in the community on a daily basis, because it would give us a chance to actually come to a point in the community where the elders maybe are already doing some of their healing work, where other healing activities are going on that are culturally appropriate, where people feel safe and feel like this is a place that they own, that I'm stepping into, instead of asking people to come who've historically not been treated well by outsiders, who historically haven't learned to trust the mental health system, and I'm asking them to come step into my office where I'm the one who theoretically is in control. I would love it if there was a mental health center in the north where it was predominantly run by the communities and I was the guest stepping in. I was asked to bend my practice to do culturally sensitive care. I'd be thrilled if I could go up there, and I think it would really put the power for their health care back in the community's hands.
What are some of the needs that you see from the people there? What are the mental health concerns that they have?
Well, there are a lot of mental health concerns. There's some of the same bread and butter issues that I'm seeing down here in the south. There's undertreated bipolar, undertreated schizophrenia, undertreated depression and anxiety. What I'm seeing that's specific to the north is a lot of despair because these people don't have access to the same basic services other Canadians do. And we live in a very small, interconnected world now. They can see on the internet what the quality of life of most Canadians are, and yet they're watching family members die young from things that should be preventable. They're watching a ridiculously high proportion of their community members dying in fires, dying of childhood preventable illnesses, dying in childbirth, or they're having to go south, isolated to deliver away from their families. What I'm seeing specific to the north is sequelae of ongoing underfunding, ongoing under access to resources that I'm afraid is only going to get worse with the cancellation of the STC.
Thanks for your time today, Sarah.
Thank you very much.